Unconscious animals and severely depressed animals are the first emergency situation we'll discuss. This can be a confusing situation as there are many conditions that might cause an animal to be found unconscious or very depressed. The possible causes range from head injuries to severe anemia. Many illnesses and conditions can manifest themselves in this state, especially when the patient is in late stages of a disease. Unless the person responding to the emergency has knowledge as to the cause of this reduced mental responsiveness, it is best to minimally manage these patients and transport them immediately. In most cases, first aid for the unconscious animal should be limited to keeping them warm and transporting them immediately. A muzzle should probably be avoided unless they are determined to be awake enough to be potentially dangerous. If they show evidence of possible trauma, move them carefully to a board. Pay attention to their breathing as this may be compromised along with their mental state. If the animal is not breathing, as determined by watching for chest movement, the caregiver may elect to start CPR. Never attempt CPR on a conscious animal. This option is not for everyone, but many concerned pet owners will want to do everything possible to save their pet, especially in the event that the unconscious animal is not breathing. Anyone finding an unconscious animal should first assess if the animal is breathing or not. If they are not breathing, ask the pet owner if they wish to attempt CPR. This should be discouraged on stray animals or pets with illnesses that may be contagious to people. If the owner of a previously healthy pet wishes to perform CPR, then the following step-by-step process should be described. With a dog or cat lying on the ground and with the head extended straight out in a normal position, the tongue should be pulled forward between the teeth, closing the mouth around it. Make a seal with one hand cupped around the nose. The CPR giver should then place their mouth up to the hand cupping the nose and blow into the nose so as to inflate the lungs fully. They should remove their mouth until the air leaves the lungs, then repeat the inflating process a second time. If the lungs will not inflate, they should carefully check the mouth and throat for a possible choking obstruction. If the unconscious pet does not start breathing and there is no evidence of a heartbeat felt on the chest just behind the elbow, then complete CPR should be initiated. With the animal lying on its right side against a firm surface, have the pet owner compress the chest and heart approximately once a second, as demonstrated here. A hand on either side of the chest will improve chest compressions on small dogs and cats. They should depress the chest approximately 1 inch with each compression. Large dogs will require the use of 2 hands working together, pressing straight down in order to adequately depress the chest 2 to 5 inches. After every 5 compressions, inflate the lungs once, as discussed previously. If 2 people are available to perform CPR, then one should do chest compressions while the other does the breathing. Continue this process and plan to transport immediately. If no one is available to drive while performing CPR, then have them just concentrate on driving the pet to the veterinary hospital and do not try to perform CPR simultaneously. CPR should be stopped if the pet starts breathing again.